November is Diabetes Awareness Month, and joining me today is Jen Willhelm, who is on the Portneuf Medical Center diabetes team. So Jen, thank you so much for being here today. So of course we mentioned it's Diabetes Awareness Month. So just talk to people a little bit about like testing and diagnosis when it comes to diabetes, just that process for them.
Right, so November's National Diabetes Awareness Month to bring awareness to folks living with diabetes, to bring awareness for screening for early diagnosis, to begin treatment for best outcomes as well too.
Okay, and when we're talking about the screening, talk a little bit about technology and kind of how it's changed over the years, where it stands now in terms of technology.
Sure, so screening is going to happen most often from a primary care physician with routine lab work, or maybe more specific lab work to check a 3-month average blood sugar level in an A1C lab test. And that screening then is going to be a little bit different than some of the technology that's out there, which is really for folks that are living with diabetes to help with monitoring blood sugar levels. That's where we've seen a lot of technology come around over the last multiple years. And folks may have seen somebody in their family out to dinner with a sensor or a continuous glucose monitor that they've maybe noticed in the back of the arm for someone. That is giving the opportunity for folks with diabetes to see the blood sugar easier, meaning without finger sticks or with much less frequent finger sticks, and be able to see the blood sugar easier and more frequently as well.
Okay, and also with that screening too, the results are pretty much instant these days. You can find out pretty quickly if you have it, what the level is. The results are pretty quick.
From lab tests from your physician? Yes, absolutely, absolutely. Those sensors are going to be used for somebody that has a diagnosis of diabetes. So most insurance companies can assist with coverage for those for persons that are using insulin. That's really where most insurance companies will assist folks with that.
And when we're talking about going in and meeting with your primary care doctor to potentially get those screenings or the testing, or is it something that's kind of done as a routine checkup, or there's some symptoms that if maybe people are concerned something might be wrong, they could go in and talk to their doctor?
Absolutely. So screening for diabetes occurs with every year, routine yearly wellness visit. That's part of that physician screening process. If folks are having symptoms of elevated blood sugar level, feeling tired, frequent urination, frequent thirst, then they can ask to be screened or go in and see their provider that way. But many times those symptoms are later on when the blood sugar levels are more elevated. So that screening when we're feeling fine and well is best place.
Okay. Jen, thank you so much. We appreciate you being here today.
Thank you.